Good morning. In response to Bob's question, I posit today that the two most significant ways to improve care for youth are for the mental health field to take an active role in sharing acquired knowledge with the general public, and for the mental health field to seriously, genuinely involve youth and families in efforts to better service their needs. First, consider the discrepancy between the mental health care professionals, what mental health care professionals say their goals are, and principles and ethics versus what they actually do and what the public actually experiences. There seems to be a very little awareness within the professional community of the consequences of inaction by mental health professionals. It is as if they're unaware of the repercussions I have heard about and have seen in both of my capacity as a young person working towards organizing activism on the part of youth, as well as my experience in CASA advocacy. In general terms, there's been a notable discrepancy between the research findings and conclusions of mental health care professionals and what is actually being implemented. By implementation, I mean the methods in practice and what the public experiences. This discrepancy has contributed to a great deal of misinformation circulating in the general public regarding the viable methods of treating youth with mental, behavioral, and emotional issues. What research has proven to be effective has not been what has actually been implemented. As a former program participant at a facility which claimed to be therapeutic, I'm appalled by some of the methods which have come to be seen by the general public as effective in treating and rehabilitating youth, and the corresponding silence of the mental health community at large. It is my sense that this is symptomatic of a larger problem within the mental health community, a problem of complacency, the assumption that the end of the line for a researcher or analyst within the mental health care profession is when the research or analysis has been completed. There appears to be a sense that once a study has been complete, the job is finished. The reality is the obligation of the experts extend much further. It involves dissemination of information and advocacy and taking an active stance on issues that are not consistent with standards and principles of care. For mental health professionals, as the pursuers of knowledge and as care providers, it is important to share the knowledge that has been acquired by the profession in terms that may be easily understood by the general public. Not only is it important, it is an obligation. The notable absence of advocacy that has given rise to mental health armchair intellectuals who may state a definitive message in the mostly invisible texts which remain generally unseen by the public at large. And I ask that and expect more out of the mental health community whose time it has come to step forward and take a definitive stance based on research and practice and reach out to those most affected by the silence. I ask you to consider for a moment the recent death of a young man named Martin Lee Anderson at a boot camp where he was incarcerated in a facility aimed to rehabilitate youth, using methods which have been largely debunked, by which the media and the public alike seem to still believe are viable methods to induce change in youth. This is an example of the consequences of neutrality by mental health professionals in instances where practice standards and ethical principles are clearly being violated. Neutrality creates not only a disconnect between stated mental health standards and principles and how they are translated into policy, but also fuels the perception that such faulty and unethical methods are legitimate, both in the eyes of the public as well as in the eyes of the youth being treated, or rather mistreated. Surely we can do better by young people like Anderson, and yet the general silence of mental health experts following such tragedies creates a sense that the mental health community is either too disconnected or simply not concerned with what we are continually putting youth in positions where mistreatment is possible. In a profession where care and ethics are emphasized, I can't help wonder where's the outrage. It is difficult to understand precisely how or why experts with the knowledge base to speak with authority and how to best care for youth have remained notably silent and inactive. The assumption I make here is that without an educated public, a cultural shift is impossible. Without proactive experts speaking out and practicing what they know works toward achieving this end, change that revolves around not only treating youth but preventing the mistreatment of our nation's young people will be slow to come. It appears that the responsibility to share knowledge and advocate for children's mental health has fallen largely on families. It is my sense that in addition to the responsibility of mental health professionals in disseminating information, additional work must be done in advocating together with youth and families, which may truly empower those with mental, emotional, and behavioral issues. It involves listening to the voices of youth in order to recognize and take into account areas which are critical in improvement. To give you an example of what I mean about listening to youth voices, I offer a small portrayal of my own experience working with youth. A year ago, I noted that there were numerous young people conveying similar experiences as my own about the trauma inflicted upon them at behavior modification facilities. I began a forum related to this issue, and what initially began as a 10-member forum grew into over 800. In my work with these former program participants of these boarding schools, it has become clear that misinformation has been a great obstacle for professionals and family alike. Youth and parent descriptions of formal mental health care they have received, both in public agencies and private practice, reveals high variability in quality of care being provided by professionals. Misinformed professionals and poor quality of care contributing to the growing sense that incompetence within the profession is widespread. The impression leads some young people who may genuinely need care to avoid attempting to obtain care. Currently, the mental health field is thwarting its own progress by not listening to populations it aims to serve. Recognizing the legitimacy of the problems that become apparent when you really listen to what youth are saying is challenging, yet it may prove invaluable for improvements of a profession whose very purpose is to assist individuals in becoming healthy and self-actualized individuals. I've learned the significance of connecting with people and agencies, as well as shouldering some of the burden through advocacy. These values are consistent with the principles of systems of care. By assisting in the growth and empowerment of individuals and families, the standard the mental health community has set forth as ethical principles do not stand in words alone, but in deed. Words without action are meaningless. Words without implementation can and have great consequences. I challenge the mental health community today to work toward reaching out and engaging the public to make knowledge known and learn alongside youth and families to really live and practice by the principles which it claims adherence to. Thank you.